Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Nathan. Nathan, please introduce yourself.
Hey everyone, my name's Nathan Hale. I'm a current administrative fellow at Mayo Clinic and um, just really excited to be here, talk more about fellowship experience and grad school experience, and hope I can help.
We're so happy to have you with us this evening, Nathan. Thanks for joining us. So, you have a bachelor's in healthcare administration. A lot of people, it seems like they have a bachelor's in something and they transition to healthcare administration later. Did you know
Yeah.
you wanted to be in healthcare administration right from the beginning?
So for me, I was very fortunate to find out early on that I wanted to do healthcare administration, but it wasn't always the plan. But for me, it started out as I knew I wanted to be in some sort of healthcare related area, but I knew I didn't want to be on the clinical side itself. And so I started initially with a public health degree at my undergrad. And for that degree, we were required to take an intro to healthcare administration class. So I took that class, and within a week or two, I was like, okay, this is it. It's calling me, and haven't looked back since. I was very fortunate in that regard. Undergrad was in healthcare admin, and then I loved it so much that I continued on into master's degree doing healthcare administration. But that was kind of like the initial interest, wanting to be involved in the healthcare scene, but not wanting to play a clinical role, wanting to be part of like decision making though, and helping with improving processes and quality and whatnot.
Excellent. That's good for you. I know it's always challenging when you have to switch midway for some of our other fellows.
Yeah.
I want to ask about that. One of the things I've been wondering is when you get your, bachelor's in healthcare administration and then you get your master's in healthcare administration, do you find yourself learning lots of new things in the master's program?
Not necessarily. I'd say that it's a review in some regard, but it's at a higher level and it is still beneficial. Now, there was some crossover where I'd be in a healthcare finance class, and funny enough, I actually had the same textbook that I used from undergrad. And so, in that regard, it was nice because I saved money. I kept the textbook from undergrad, so that was really nice to use that again. But they were two different learning environments. So, like for an example, in undergrad, it was learning all of it for the first time. In grad school, it was a confirmation of what I had already learned, but adding on to it. So adding more details. And then on top of that, a lot more case studies in grad school. That wasn't something that I was anticipating. And it was something that I was very grateful for because I find that post graduation, I use the case study model in my head a lot when I'm trying to solve problems. And so it's been interesting to see how school has played a role. I think in the moment, it's kind of like you're tied to the classroom and you're ready to spread your wings and fly away, as cheesy as that sounds. But once you get to the field, you realize, oh, wait, like the stuff I was learning, I can see why I learned that now. It's so
Mhm.
important and everything. And so, yeah, some crossover, but I wouldn't say I have like any regrets or anything of doing both healthcare admin because I think if anything, it just helped me learn it maybe faster in the grad school setting and understand it faster. But I still have plenty of questions. I'm a curious person.
Nice. That's great, though. That's really
Yeah.
good. And then, can you give us an example of what that looks like? Because I'm, we're just starting to go over cases in business school, and so
Mhm.
what does it look like when you apply them in terms of the thinking process? You said that you apply from your cases that you went over in the real
Mhm.
world. What does that look like?
Yeah. I think I think every student you ask is they might have a different answer depending on where they went to grad school. With University of Utah, at least, they were very intentional on using case studies from real life experiences. And so the faculty, one thing that I loved about my experience there was the case studies that we went over in class were from real life experiences of the faculty from when they were working in hospitals, leading hospitals. And so a lot of times what it would look like is they would give us this real world scenario. Our homework would be to solve the case and then come to class with our solutions. But then it led to open discussion. Like, I thought of this. Oh, I didn't think about it that way. Well, I thought about this. Oh, I didn't think about it. Really good discussion. And the teacher was able to say, like, oh, we tried that, but it didn't work out. And then the end of the class would be the ultimate decision that the teacher did make. And so it was cool just seeing like the full circle because you were so invested in the actual case. But as far as like transferring that to work now, the models that they used were very helpful for me. And so I think it's a Six Sigma model: define, measure, analyze, improve, control. But that's one that really helped me. And so, like, if I'm in a scenario where I'm trying to solve a certain issue, I'm working on a project, and I just need to kind of get my bearings, then I fall back on that. Okay, define the problem, measure opportunities, analyze, improve, control. Like, what is the step rather than going right to the solution? Having a rubric has helped me a lot. University of Utah had a specific outline for case studies as well that focused on identifying like key stakeholders, important facts to consider, and then also considering alternative solutions rather than just jumping right to your recommendation. And I liked that too because it gave me it allowed me to strengthen my, I'd say, my critical thinking muscle. So instead of just like, oh, obviously it's this, I had to consider, oh, but now that I think about it, that actually wouldn't work. And so I'll list that as an alternative solution if XYZ happens, kind of thing. And I liked that. And I've found that in my work today, I use that as well, where I consider other alternatives and then ultimately come down to one solution. And I'm not saying that's a University of Utah exclusive thing. That's all I have to speak to since that's where I went. But that's something that I've found myself actively using in the real world as I'm in the fellowship.
I think that way of doing the cases is pretty special, where it's things that the faculty actually have experienced.
Yeah.
Yeah, because that's a big deal. That's really nice.
Yeah. And that was something that was like appealing to me with University of Utah. I wanted to go to an MHA program that had people who worked in the healthcare field. I think there's pros to, I mean, obviously, there's going to be pros to any program you go to for grad school, but that was just something that stood out to me. And it was something that I was looking at pre grad school and post grad school. Looking back on it, I still stand by the belief of like, oh, yeah, that was so instrumental in my growing and learning experience. So, really appreciated that.
And I think too, the idea of how they taught you how important the process was, like you said, like
Yeah.
not jumping to that endpoint, because
Yes.
that is like, I don't, have you gotten your Six Sigma green belt yet?
I haven't. You know, it's funny. I paid for a program to get it virtually probably a year and a half, 2 years ago now, and I made the mistake of doing it while I was actively a full-time student, and so it kind of got pushed to the back. But I still have like the credit to do it, and so I just need to do it now. But I've I've learned practices in the classroom setting, and I know classmates who took. We had a Six Sigma green belt option to take. Like you could take that class, and it just didn't align with my schedule. But I know students who did do it, and I want to do it. It's on the healthcare admin bucket list, if you will.
Yeah, of course. Yeah, because it's like a lot of that's what you're saying is like the most important. I felt like was the most important parts of it is the stuff that, like, yeah, there's like the statistics and like some of the frameworks that are cool,
Yeah,
but it's the idea that you need to like force yourself to like walk the process, to like the
exactly.
continuous improvement mindset. Like the stuff you're saying is like the most important part.
No, exactly. Yeah,
So you came out of, grad school. It seems like you're really well prepared. It seems like they had a really good program, and then you have some experiences, of course, but then you decide to go for a fellowship. Can I
yeah,
ask what was your reason for applying for a fellowship? Did you consider not doing one? How did that look?
yeah, yeah. Oh, no, absolutely. So for me, it's interesting. I have a bit of a unique experience in that I didn't know I wanted to do a fellowship until the deadline. So for Mayo Clinic specifically, I turned in my application 2 days. Or no, no, I decided I wanted to do the fellowship 2 days before the application was due, and then I turned it in a day before it was due. And I luckily already had letters of recommendation available because I was window shopping. I was like, I think I want to do it, but it wasn't until like 2 days before that I was like, okay, I made my decision. I'm going to apply, kind of thing. It's going to be different for every person, but for me, the reason a fellowship was appealing was I was coming to the close of my grad school degree a year into the program, and I still hadn't found that area of healthcare that I wanted to work in. I felt like I still wanted to learn more. I mentioned earlier I'm a curious person, and I think a lot of people can relate to that. At least people I've talked to, where it's interesting. I think going into the grad school program, I was thinking this is what I do to find out what I want to do in healthcare. But instead, I learned more about healthcare and I had even more questions about what I wanted to do. So it's kind of like a good problem to have. But I wasn't I didn't have a firm path, like a clear direction on what I wanted to do. And so a fellowship was appealing to me because it offered just more exposure to healthcare, and specifically a rotational based fellowship was what was appealing to me because getting that further exposure, and then on top of that getting exposure to specific departments. And so the fellowships that I was looking for and applying for were all rotation based, and that's just what I was interested in. I have friends who are in project based fellowships, and I also think those are great. I think it's going to be very personal for what you're looking for, but for me, I wanted a rotation based one so that I could be somewhere to get more exposure to different areas and different departments to further help my I guess my path and get a clearer idea of what I wanted to do in healthcare ultimately.
And so, with that, leaving it up to the day of for the Mayo Clinic,
Yeah.
how many
Yeah.
did you apply to then? If I missed it, let me know. But
Mhm.
how many was
No,
that
no,
in
you're
total?
good. That's another I'm also kind of unique in that regard. So I applied to 2 fellowships.
Okay, that is pretty unique. That's one of the
It
I
ex
the lowest one we've heard is one.
Dang it. Oh, almost
Yeah, I
had it.
know. So close.
Yeah, and the funny thing is this other one I applied to, I didn't get far in at all. And so it
Really?
yeah,
Wow.
no, I didn't. And so it's interesting to see the night and day difference. Like one, I mean, it works out and I got the job, and then the other one, like I had a virtual interview, and that's all that happened. But for me, the reason I was very mindful of what the number of fellowships I wanted to apply to. I wanted to do a fellowship at an organization that I could see myself working at post fellowship. I didn't necessarily want to do a fellowship just to check it off the list. Like, okay, I did a fellowship, I can add that to the resume. Now I'll continue looking for work. And I'm not saying that's how all fellowships are. I've met other people who they do a fellowship, and then after the fellowship's over, it's not guaranteed that you'll stay with the organization. And so I wasn't interested in applying to a lot of fellowships. I was interested in getting exposure, but I wanted to be like, I was very mindful in only applying to places that I could see myself working at full time. And so that's why I only applied to 2. I'll say I had 2 applications ready, but I had already heard back from Mayo Clinic, and so I didn't submit those ones. So technically, you could say 4 was on my radar, but that's solely because I only wanted to apply to places that I could see myself at full time post fellowship. And I was also treating the fellowship in that regard where I really wanted it to be getting my foot in the door with an organization rather than just adding to my resume that I did a fellowship. And so I think that's why so few for me at least.
And so, with that in mind, you have a lot of things you were looking for. You were being pretty specific about what fellowships you were applying to. I want to ask this, and not necessarily from the perspective you're in now, but from the perspective you were when you were applying.
Yeah.
Other than the rotational nature, what drew you to Mayo Clinic?
Hmm.
What made you say, I want to be here for the next, 10, 20 years or what have you?
Yeah. No, totally. It went back to so Mayo Clinic. I think for one, Mayo Clinic, you hear about it in the classroom setting, especially when you're studying healthcare administration or any health related degree. It comes up in case studies or it's mentioned in various reasons. And I had first really learned about them in undergrad. We were assigned to do, I think it was at random too. I don't even think I chose the Mayo Clinic, but we were given a well-revered healthcare organization to do a project on, and you were supposed to basically dive deeper into what the organization looks like on a day-to-day basis, why they're well-revered, so on and so forth. The fun presentations you have to give for classes. And So I was assigned Mayo Clinic, and that was my first exposure to it. It's funny because I'm from Arizona, and I knew that there was a Mayo Clinic here, but I just hadn't really thought about it too much. And it was that presentation that made me realize, oh, this would be an interesting place to work at someday. Like, I'd love to actually consider that. But I was in undergrad. I knew I had a while to go, so I kind of put the thought to the side. And then when fellowship season came around, I was iffy on if I wanted to do a fellowship. That's another thing that was unique about me. I wasn't like all in on doing a fellowship. My attitude was if I get a fellowship, perfect. Like then I'll go that route. But if I don't do a fellowship, it's not the end of the world. It just wasn't meant to be. I'm going to go this route instead. And so I think that also goes back to why I applied to so few because it wasn't end of the world kind of thing if I didn't get one. But with Mayo Clinic, I knew that they had a fellowship. And I say that I decided 2 or 3 days before the application was due, but it was after like months of thinking about it. It was like weighing the options. Do I want to stay in Utah because I loved the life I had established there? I'd met a lot of great people. There's a great healthcare scene in Utah, and I was just very interested in staying there. And so that was the hardest thing. Like, am I willing to move? But then it just kind of came down to this organization, Mayo Clinic, is something that you've thought about before and that you care about. And so, what does it hurt at least applying? The reason that there was such an emphasis on Mayo Clinic to begin with, besides the class project that I worked on, was I was very impressed by their values. As anyone does with job searching, you get to know a company, you get to know their values, their mission statement, and all that fun stuff. For Mayo Clinic, they have 8 core values. It's an acronym, RICH ties. So it stands for respect, integrity, compassion, healing, teamwork, innovation, excellence, and stewardship. And as I was going through the different values and preparing for the potential of getting an interview, I realized that each of the values were something that I could relate to, that I felt connected to them. And if it wasn't Mayo Clinic, I learned from the experience that I want to work somewhere that I can relate to in that regard. And so I'm incredibly blessed that it worked out with Mayo Clinic, but to anyone who's watching, I would say have that as a requirement for anywhere you want to work. Like, see if you align with their values and with their mission. That was the biggest thing for me in Mayo Clinic. And so I was very happy that I was able to be offered a position and work at an organization that cares so much about putting the needs of the patient first and then having those 8 values that I mentioned to support that ultimate value of putting the patient first. So it was just in a nutshell, I know I just gave the long story, but in a nutshell, just working for an organization that had the same values as I did was very key for me.
It's interesting too because I found that in talking with different, fellows, different executives, it's not just, the organizations that we go into. We're not just looking for an organization that
Yeah,
we're going to work with, but it's also that it's going to shape us. We are going to
exactly.
My mindset when I first started in healthcare was I was very like academic research is what I was really interested in doing.
Yeah,
And Jefferson does some of that, but not like as much as like Penn does or
sure.
MGA. And so my mindset has shifted as well. Like
Yeah,
Jefferson's
yeah.
big in population health, so now my mindset is towards population health, and
Mhm,
those values are incredibly important, not just
mhm,
because of what we want to do, but how it's going to affect us.
mhm.
What I wonder too is now that you have worked there, do you feel like it exceeded expectations?
I do. I really do, and I promise I'm not just saying that because I'm a fellow there right now that I'm, like, here working for them. It really is a thing that I was actually the closer it got to the fellowship start date, the nerves started kicking in, like, "Oh my gosh, I'm working for Mayo Clinic," like, I was in complete denial, to be honest. And so it was very nerve wracking. Easily the biggest place I've ever worked for. And so I just didn't know what to expect. But within the first week, I'll say the first 2 weeks, because the first week was all orientation and it was a little overwhelming. I think that's the case with any fellowship though. But within the first 2 weeks, I already felt like it was my home, as cheesy as that sounds, like it was the
Nice.
right place that I was supposed to be at. And I had studied these values and learned about how Mayo Clinic lives these values. But there's always that concern that when you're starting somewhere, it's like, okay, like how good are they really at living the values kind of thing.
Yeah,
And
exactly.
I can confirm that like just everyone was so kind, down to like you walk by someone in the hallway and they smile and say hi to you or say happy Friday if it's Friday, like, little things like that where you never talk to that person, you never work with that person, but they start becoming your like hallway friend because you run into each other from time to time. And especially being a new employee and being a deer in the headlights, that made such a big difference. And just receiving that hospitality from someone who had worked here for 25 years or more, I felt like I was already part of the team, even though I had been here for a week or two. And that still continues even now. Like, I'm still very young at Mayo Clinic. I've been here for 8 months, but I feel like the expectations have been met. And kind of like what you were asking, they have been exceeded because I didn't know what to expect, but it's more than whatever initial thoughts I had, I guess. Just very welcoming environment, very kind, and they really do. One thing that think is neat is the primary value of the needs of the patient come first really is lived in all the employees, regardless of what your responsibility is. And so I could be working on an Excel sheet, and although I'm not in the front line working on the clinical side and seeing patients face to face, I'm still doing something to move that vision forward of putting the needs of the patient first. And that is what really drives home, I guess, my appreciation towards Mayo Clinic in my experience thus far.
That is really wonderful because it is that worry when you
Yeah,
start, and especially when you're not in direct, 'cause when you're in direct patient care, I think in a way, like you are, it doesn't matter what the organization's choices are, you're always going to be doing the best for the patients. But when you're in
absolutely.
administration, it's like, am I really going to be helping patients or am I going
Yeah,
to be, so it's nice to see that you feel like you're able to really touch people's lives
yeah.
and that you're really living those values. That's beautiful.
Thank you. Thank you. I agree.
Yeah. So I want some more technical details too, because it's such
Okay.
a big organization. How many employees do they have? Are we like 100,000 or like how many employees
Oh
are
my
there?
goodness. I don't even know if I could answer that. That is a good question. I should have done my homework. I don't know that I know the answer to
I'm
that.
gonna have to look this up here, and because there's a bunch of different locations as well, right?
Yeah, exactly. We have 3. Okay, let me take that back. We have 6 sites in the country. 3 of them are destination medical centers, and then we have the health system, which spans across Wisconsin and Minnesota. But the one I'm in Phoenix, and then there's Jacksonville, Florida, and Rochester, Minnesota.
And
That was the first
Rochester,
one. Yeah, and those are like the 3 kind of
the medical
big.
tourism.
Yeah, yeah, the big medical centers. So
Okay.
we have those 3, and then we have 3 additional health sites. But then even beyond that, we have additional clinics throughout. And so, like, for an example, here in Arizona, there's the Phoenix campus, but then there's also the Scottsdale campus. And then we have like a sports and ortho medicine campus in Tempe. And so things like that. We have like a separate campus in another area, but the 2 big campuses are Scottsdale and Phoenix. So I do not know the answer to that.
It's impressive. I looked it up just now. 80,000 employees, so about double the size of Jefferson.
Wow.
With that in mind, have you met the senior leadership? Is that something that you've been like? Have you met the CEO? Like, what is that
That's a
like?
good question. Yeah. For Arizona, yes. For Rochester, no. And that's just because I'm in Arizona for obvious reasons. But yeah, so Mayo Clinic is interesting in the fact that they're not a traditional health system in regards of like the CEO is admin related. And so the CEO is a clinical doctor. His name's Dr. Gray here in Arizona. And then we have CAO, which is like the equivalent to an administrative CEO at another organization. And they're just the chief administrative officer. But I've met with both of them. They they set up a one-on-one for us to meet with the CAO specifically to better get to know her. Her name is Roshi. She's incredible. But then also just in random interactions. So I've sat in meetings with them and then been at conferences where I ran into them and whatnot. But it's cool because they get to know you. You're not just like another person working here. They know you by name and they love to hear your feedback. One thing that really stood out to me was in my one-on-one with the CAO, Roshi. She asked me, she said, if there's ever anything you see me doing that could be improved, like please give me recommendations, please give me feedback. And I'm like, you're the CAO. You shouldn't be asking me. I should be asking you for feedback. But it was just so humbling to see that humility in her, and that she's a CAO. She's the highest you can go in admin for Mayo Clinic, and yet she's still looking for opportunities to improve. And so,
Yeah,
yeah, have had interactions with them and have been very impressed with them as well.
that's great. Wow. So how do you, are you, just for people who aren't from Phoenix, we don't need to, disclose any specific salary details, but is it with the salary that you're getting as a fellow, is it comfortable to live there? How's the
Yeah,
cost of living? What's that been like for you?
it's been great. I've been fine. There have been no scenarios where I've been struggling with money. It's been fine. I've been able to meet my needs and also pay all the fun bills and the monthly rent and all that. And so it's definitely affordable, and they provide you with that. They make sure that you're provided with the amount you need. And then on top of that, there is a relocation fee that they give to you as well to help you move to the new state and everything. So
Nice.
they're very considerate of that.
One of the questions that I'm going to start introducing, and I'm doing this for my own personal interest as well, but
Mhm.
and I'm doing this because I've been meeting with fellows in the Midwest and in the Northeast, and it's drastically different. It's like a
Yeah.
spectrum. So one
Yeah.
of the questions I'm introducing is this a roommate, a apartment, or a house rental situation that we have in Phoenix on the fellowship salary?
Oh, so that's a really good question because it's different for each fellow, I would say. So,
Oh,
like, for
really?
an example, yeah, so, like, for an example, I am renting a room in, about 30 minutes away from Phoenix, and I have roommates. It's like a house, and we each have our own room. So I'm renting a room in that regard, but I have roommates as well. We just share common living spaces. But then my co-fellow, she's living in an apartment and she's able to afford that, and she's closer to work. And so that's just it's kind of a preference thing of where you
Okay,
want to
but you're
live.
not forced to per se have 10 roommates in a communal bathroom like you might be
Oh
in New
my
York
gosh,
City.
no. Yeah, no, definitely not. I mean, if you wanna do that, yeah, by all means. If
Okay,
you wanna save
nice.
the money, to go for it, but you have enough money to live comfortably.
And do the hours are reasonable, or has it been
Yeah.
a lot more work than you expected?
No, they've been very mindful. They care about work-life balance as well, so they encourage you when you need a mental health day, like, take a day off. They want you to show up being your best self and feeling your best as well, and so they're okay, like, obviously we have PTO and whatnot, but they're okay with you taking a day off if you need to just kind of re refocus. But on top of that, they also encourage you to like take vacations. If you have a planned vacation, they want you to take it. They're not like, oh, what's that going to do to your work? Like nothing like that. They like one of the first things I think they that we learned in orientation was like your mental health is important, take time off. Like you have PTO for a reason, use it. Don't let it go to waste kind of thing. And then on top of that, they really care too about your work life balance. And so in my one-on-ones with my site director, she has been very mindful of asking like, how is life outside of work? Like, have you had things to do? How are you doing? Like, are you enjoying Arizona and adapting to it? And I know from other fellows I've heard from in at Mayo Clinic and other sites, it's very similar there as well. Like, we encourage you to get involved with the community and find cool new hobbies and whatnot. It's not it's far from a job of just like showing up to get your work done and then disappearing. You feel like you do play a role here. And that's been very instrumental, I think, in going back to what we talked about in exceeding my expectations. Like I feel like I'm an active member of the Mayo Clinic family. I'm not just here to get a paycheck kind of thing.
Mm, that's really wonderful. I'm happy
Yeah.
for you, Nathan, and I'm happy for Mayo Clinic that they get to have someone who's so skilled. So
Thank you.
congratulations on that. That is excellent. And thank you again for joining us this evening.
Yeah, thank you so much, Cole. Happy to be here.